Hello, welcome once again to another episode of Living the Journey, the podcast. Today, we will be talking about an important topic that is egg cryopreservation in future IVF. My name is Saira Bernes, and I will be guiding you along with our team of experts in this topic. If you are someone that is not ready to be a mom, to have a baby, or is facing medical conditions, this episode is for you. Well, for this first part, let's welcome our special guest, Jessica Manzo, who is part of our journey coordinators.
Thank you, Saira. It's so nice to be here.
Hello, Jessica. Welcome to this first part of the 6th episode, and I will be starting with a question. Can you share a little bit about yourself and your role at LIV Fertility Center?
Yes, of course. So I am a journey coordinator, so we are the ones that are in charge of course, doing the first contact. And we give you the information in regards to all of the procedure, the steps to follow bit by bit, and as well as set up your online evaluation with our specialist. Of course, all of this to get started with your journey.
What exactly is cryopreservation, and how does it play a role in the future IVF?
The egg cryopreservation is something that, sometimes not a lot of us look into or have knowledge of that can be done. Egg cryopreservation is the freezing of the eggs prior to maybe in the future wanting an IVF procedure. So if, let's say, I don't want to get pregnant right now, but I want to reserve what would be my eggs, keep them frozen for a future, maybe in 5-10 years, do an in vitro, then this would really benefit us in regards to freezing the eggs.
Can you walk us through the process of egg cryopreservation step by step?
The egg cryopreservation, of course, it starts with the first steps in regards to speaking with the journey coordinator, setting up the online evaluation, and becoming a confirmed patient with us. Once that is performed, the medical team follows up for the patient to arrive here on the first days of the period. The first consultation is an ultrasound alongside with some blood work. After that, of course, the doctor is going to be the one that indicates the dosage that has to be used. The stimulation, generally speaking, can take from 10 to 12 days. And during those 10 to 12 days, the patients come in each 2 to 3 days just to monitor how the medication is, or how the body is responding to it. So if there's an increase of the medication, the doctor can do it at the time that is, the best. And afterwards, we give the last injection, which is the trigger shot. 34 to 36 hours later, this is when the patient does the egg retrieval. On the day of the egg retrieval, we can expect maybe from a 25 to 35 minute egg retrieval. Afterwards, the nurses do take care of the patients in regards to what would be the time of the recovery from the anesthesia. And on that day, the eggs are cryopreserved after reviewing which ones are the mature ones.
What are the most common questions that patients have regarding this procedure?
The most common questions are, how long can I keep my eggs stored? There's no limit in regards to, how long it can be stored. We have had patients that store their eggs 3-4 years, of course. And this does not really affect what would be the procedure at all. As in the future, they are thawed and then fertilized. But that is one of the most common ones that, how will I feel? How does the medication, how is it? And it's just guiding them bit by bit.
How does the Fertility Center support the patients through this process, from the initial consultation to the post-procedure care?
We support them by being there for them. Not just us journey coordinators, but the medical staff, as you as well, and all of the staff at LIV Fertility. We are there for them in regards to if they have any questions, if they maybe Google something and then they have more questions. We're there to support them and just let them know that this is something that it's going to benefit what would be their future.
How do you inform patients about the risk and benefits of egg cryopreservation for the future IVF, especially in terms of age-related considerations?
So when it comes to what would be cryopreserving the eggs, of course, the most recommended time would be before they turn 35, as it is scientifically proven that after the age of 35, the quality starts to decrease bit by bit. But if this is performed before the age of 40, it would be the best. And sometimes we're not ready to be mothers or ready to start a family. So we can cryopreserve eggs prior to 35, if not prior to 40. Let's say we have a patient that is 37, but they don't want to get pregnant until they're 42. The benefit in that is that we're using their eggs of when they were 37 years old. So, it's a lot better quality. We have more eggs.
Well, Jessica, thank you so much for being here. We know that it's your first time in this podcast, so we hope to see you soon. Thank you.
Thank you. I hope to be in the future as well. Bye-bye.
And for the second part, we will welcome our fertility experts that are part of the medical team. Let's welcome Dr. Aline and Dr. Isabel.
Hi, Saira. Thank you for the invitation.
Hello, thank you.
Doctors, welcome to another podcast. We will be starting with the first questions we have for you. Can you tell us what are the main reasons why women decide to undergo egg cryopreservation?
Well, women choose to undergo egg preservation for several reasons, but I think that two most important could be personal reasons, focused on their personal career, or medical reasons. For example, chemotherapy or any important treatment that maybe could impact in the fertility in the future.
How does egg cryopreservation offer hope and options for women that are facing medical conditions affecting her fertility?
Egg cryopreservation offers hope in women that are confronting medical conditions like cancer, because sometimes they need to receive chemotherapy, or in women with some kind of tumor, because she will need a surgery. So in this kind of patients, the cryopreservation helps us to minimize these risks of lost the eggs, and of course to the future the motherhood maintain the eggs in storage in the laboratory for use in the future.
Are there any age limits or restrictions when coming to this procedure?
I don't think that we have a specific limit. However, we must know that after 35 years, there are several papers that report that after 35 years, the quantity and the quality of eggs decrease. So we must recommend our patients to think about that before 35, because the success rates increase in the future when they want to use their own eggs. However, if they want to continue with the plans for cryopreservation after 35, we must tell them that probably they of course can, but the success rate will be decreased, talking about quantity and quality, and they must be performing more than one cycle.
What should individuals consider when deciding if cryopreservation is for them?
There are many factors that you need to considering. For example, the age, the ovarian reserve, the disease, if you have disease that affecting the ovarian reserve, the personal goals, and well, you need to try to talk with an specialist or have a checkup and tell you what kind of treatment is better for you.
What is the meaning of future IVF?
Future IVF refers to the process of making the embryos when the patient wants. So in this fact, or in this process, we use the frozen eggs. We thaw them, we fertilize them in the laboratory with the sample sperm, and then when the embryos are created, we choose the perfect moment to transfer them into the uterus of the patient again.
And can you let us know what is the maximum age or limit age to perform this future IVF?
There isn't a maximum age, however, it's advisable to perform before to the 45 years old for try to reduce the risk during the pregnancy, like high blood pressure, gestational diabetes, or delivery premature, or preeclampsia.
Is there any risk related with performing an IVF in the future?
The risk about the IVF in the future, for example, after 40 or 45, it's related to the hormones. So, because in the endometrial preparation to put the embryo again in the uterus, we use hormones like estrogen and progesterone, we need to assess that the patient don't have risk or a low risk of, for example, breast cancer. We need a mammogram, we need a pap smear, we need the studies to determine which is the perfect moment or what are the risks for the patients.
What advice do you have for individuals considering this procedure as part of their family planning journey?
My advice will be to research the procedure, take a consultation with a fertility specialist, see the benefits, the risks that are involved during the procedure in order to make an informed decision according to your situation.
Well, Dr. Aline, Dr. Isabel, thank you so much for being with us and sharing this information. We hope to see you in the next episode.
Thank you.
Thank you. See you soon.
Well, we are almost done. And for this last part, let's welcome one of our lab team members. She's one of the embryologists of LIV Fertility Center. Let's welcome Fernanda Renteria.
Hi, Saira. Thank you.
Tell us, Fernanda, how long can eggs be stored through the egg cryopreservation? And are there any risks associated with long-term storage?
Well, the vitrification techniques allows the oocytes to be preserved indefinitely, since time does not affect their quality. They remain in the same conditions as when they were vitrified, since their biological activity is stopped. Currently, there is no evidence that there is any risk associated with prolonged storage time.
Can you discuss the success rate of using cryopreserved eggs compared to fresh eggs?
At LIV, we have our protocols and quality control standardized. Therefore, fertilization, embryo development, and pregnancy rates are basically the same using both vitrified and fresh oocytes.
What are the main factors that influence the viability and quality of eggs during cryopreservation, and how do you mitigate potential risks?
The vitrification technique is complex and requires an experienced embryologist. In LIV there is no problem, as our protocol is very safe and there is no risk to the oocytes. However, the success of vitrification depends on the quality of the oocytes before freezing. And this in turn depends on the maternal age. After the age of 37, the ovarian reserve declines and the oocyte quality begins to be compromised.
Are there any specific protocols to maximize the chances of successful fertilization in the embryo development using cryopreserved eggs?
At LIV, we have a vitrification survival rate of 98%. We use the best quality vitrification technique and media to achieve this.
How do you determine the number of eggs to retrieve and freeze for a patient undergoing this procedure, considering factors like age and fertility goals?
First of all, the number of oocytes to be recovered within a follicular capture depends on the patient's response to ovarian stimulation. This in turn depends on the ovarian reserve of each patient. The doctors are in charge of stimulating and monitoring the development of the follicles, and once they are obtained in the capture, within the laboratory we evaluate the degree of the maturity, and only those that are mature are candidates to be cryopreserved.
What are some common misconceptions or myths surrounding egg cryopreservation?
To mention a few, there is the idea that egg freezing is a new and experimental procedure. Actually, it is not new and it is standardized and proven. Another one is that you can freeze your eggs whenever you want. The ideal is to plan and perform it at the right age, and also that you can freeze your eggs and conceive naturally in the future. This is a wrong idea. When you freeze eggs, it's necessary to perform an IVF in the future.
So thank you, Fernanda, for sharing this information with us. We hope to see you in the next episode.
Thank you for the invitation.
And well, this is the end of this episode. Thank you for watching. We hope that you enjoyed it. And if you are someone who is facing medical condition problems that affect your fertility, or you are not ready to be a mom yet, this information can be helpful. So please do not hesitate to reach us. Remember that you are not alone. We will be happy to assist you during this journey. My name is Saira Bernes, and I'll see you until the next episode.